Dr. Demby. We will talk on the World HIV/AIDS Day and the strive them with government or Minister of Health don't take for tap the sick or the disaster in the country. And later we'll talk about the suspected hemorrhagic fever then the case study or within the surveillance now in the country. I want to welcome Dr. Austin Demby inside the program. Good morning and welcome to the program. Good morning, Salon.
Thank you very much, Musa. Good morning to you, listeners.
The last time we've been get you, Naya, you've been can talk about and the doctors about the fuel, and we see other concerns. Though today we can look at the HIV/AIDS Day and also other issues then at the well body sector. But then well body workman and then get for handling situations here. Waiting at the current standing of that issue. We've been there get here the last time on.
Well, you know, the Ministry of Health now, well body business, as you say, and we're not able to do well body business without the workman. So the workman is central and the backbone of the ministry in response. Usually we get small cham with regard to the compensation and allowances, but I think we tell God thank you so far. Things they go on as well as we could imagine. We don't resolve some of the fuel issue them. We're having big problem. And we did look at the fuel issue for other people that we deserve them. And we did look, the government try to see how to bring a broad-based compensation increase for the healthcare worker. So again, I think we did try. We know it's the 8th, but we did try. Once now for salon we well body business, I think it's central to we workman them.
It's central to workman them and when they try for put them things here under control. And after we don't talk about the medical association that you've been seeing the nurses themselves come up with their own and them being raise their concerns then things perhaps if we need to strike they need to solve your body and back come with them position. How far we then issues then they all now then at the well body sector.
So strike not to the way forward. You know, this now essential work what they do where people in life they at tremendous risk. So we really do try for work with the healthcare worker them. No use strike as a tool, as a weapon. A lot of fair way for negotiate. I think say not to strike business make then resolve the doctor then fuel business. Now negotiations. The government not ever say will not go pay. They will say we will get the resources with the money, they will make sure so we'll prioritize payment. And the government will do that so far. With the other healthcare worker, then we try to find out who are eligible for the fuel compensation. And the PS to work with them and we try to encourage them no use strike action as a tool and figure out a way for people let them get their compensation appropriately. So they work on that right now.
All right, for getting things clear, Mr. Minister, meaning understanding only between the doctor and nurses and government.
Yes, again, not so single event, an ongoing process. We constantly engage. As I said, there is issue, they try to address them, and at times they anticipate issues and try to address them even before it comes.
All right, now, as you just update listeners about the issue may happen between government, nurses, and doctor, but waiting so far don't they happen at the ministry because you don't left here, even though you're not here, but you go update listeners waiting at the progress so far at the ministry.
Yes, I mean a lot of exciting things they go on at the ministry, but since it's a world, I don't know if we'll start with world.
Just in brief, then.
In brief, you know, I think so. This country for the longest time we believe in primary health care, and by the way, Salon Posting I may read the Alma Ata Declaration where it declared to the whole world say primary health care are the way for go forward for take care of the health of the people there. And the fundamental principle around primary health care for take health care as close to the people as possible. So now Salon now we get about 85% of the population then get a health facility within a 5-kilometer radius. We're now one of the highest at the region. What do you work on now for bring quality to that access there? That's not one thing. The second thing we want to look at, for the longest time we don't put all of the effort on primary health care, will not put enough effort on secondary and tertiary care, the hospital and the higher end services. So right now they balance a little bit more by aggressively pursuing the work what they do on primary health care and balance with secondary and tertiary health care. At the same time, we look at referral networks between the primary and the secondary healthcare system. And the fourth pillar in the effort, now health security. Health security for make sure that we're prepared, we're ready for response to any emergency with speed and precision.
All right. Yesterday, Salone me join other country than at the world for celebrate World AIDS Day. For Salone, within our status so far?
Well, as Abdurrahman just said just now, World AIDS Day now a day of reflection. A day of reflection where Salone, exempt from other countries around the world. From the 80s, where we see the first case of AIDS now in this country, we don't work very hard for deal with that. Right now, as we get about 77,000 people that will live with AIDS, will live with HIV in the country. That now a very large number for we, but a small proportion compared to other countries there. But the other really good thing about this now, of the 77,000 estimate, of the 77,000 estimate, we get 75,000 people already on treatment. And they fed for, you really they fed for that. And what you want to do now for sure say, then people are already on treatment, we're able to maintain them on treatment and let them take their drugs regularly, because if you treat, you take the drugs regularly, the drug's so good now that if you consistently take the drug, you get zero detectable virus. And if you get zero detectable virus, they're even able to transmit it to other people. So in fact, not to just treatment, now one of the best prevention tools that we'll get. So if you get over 77% of the people that were infected, were they on treatment, 97% of them they're on treatment. So now good thing. The only thing I will be fed for, now for make sure so they stay on treatment and take them drugs on a regular basis. The drug now free. The drug now one of the highest quality drugs you can find anywhere in the world a day. But the biggest problem we get about a very high fatality in Salone in spite of the treatment. Like last year, about 1,800 people and then die of AIDS in this country. 1,800. That means that if you get a 50-seater bus, them, you full up with people. 37 bus full up with people, and nine died last year from AIDS. So the problem they go AIDS. What do they advocate for now for let people they first find the status, detect the status, where the test available all side for free, and where you know your status, if you're positive, let you start treatment right away. Let you start treatment and you stay with the treatment. One of the main reasons why people are not they stay with the treatment, none of us say the drugs not available, they not stay with the treatment because of all of the stigma we are associated with HIV and AIDS. People then they fear, then they shame, then they maltreat them, then they discriminate against them. Again, all now they undercut the ability for get an effective treatment. So I think right now the call for a rights-based approach now for say this HIV thing they go away if we all know both time together, so we'll all work together for remove stigma and get better treatment outcomes. You
say 77,000 that are estimates.
Yes.
When you talk about estimates, what will you talk about?
So what's happening? For let you compare Sierra Leone and Liberia and Gambia and other countries around the world, it's important for get standard. We compare country there. Let all man not go just do their own. So then get what they call spectrum estimate, where they get model for look in a country based on the prevalence we did not see before, based on other study then, for see roughly how many people then infected. So now estimates. So now we own country we estimate now 77,000 and put on. So other country then get different estimate. But for let you compare Salone with other countries, then finally you use the same model. And we say get 77,000.
We can look at the death rates. We, according to about 1,000 died just last year.
1,800.
1,800 died just last year. We can look at that. But when you talk about the 77,000 estimates, we get key populations, who's one of the key populations here, this HIV/AIDS prevalence
Well,
density?
I think so we have to be very careful with that because no one stigmatizes anybody. Right now, about 53,000 women then get the infection compared to about 21,000 man them. Yeah. So you get subpopulations where they look at, but again, don't begin focus too much on the subpopulations, and the kind of intervention we'll get, the intervention are for all man, everybody. And in this day and age, we then kind of effective treatment here, so we'll get not a cure, but not treatment. The way the drug they work is as you they take the pill they circulate, the medicine they circulate inside your blood. Anytime you see the virus, it kill them.
Okay.
Anytime you see the virus, it kill them. But this virus is smarter in kind of it. The virus it hides inside now the body where the drug not able for reach there. But anytime where the virus come out, the drug they kill them. So now that make you get for take this drug for the rest of your life. Any day where you stop for take the drug, the virus they come back, and when it come back, it's much more lethal. So now when somebody begin take the medicine, they stop, they break, and now one pill for day, so not so. If you arrange your life and you make it available, you go to hospital. If you're normal, you're healthy, they will give you multi-week, multi-month prescriptions. So you will take the drug, it with you for a long period of time. But again, not for shame for this now illness, not to something where you put by yourself. Now something we all get for rally around and able for help people there. Because again, we don't see where you don't take this drug, you take it effectively, you're able for suppress the virus. You they live a near normal life like anybody else. You go work, you go school, you go market, you go farm without any problem whatsoever. But the important thing is for consistently take the medicine, because any day you stop, the virus they come back.
Right. Is it possible for somebody where they take the medicine well permanently?
Well, so far we not get cure for it.
Okay.
They quite explain. The virus is so smart, they go hide some side where the drug not they reach out. Like some side in the body where they carry drug inside it, like inside the brain, inside the testis. They protect now protected area inside the body. This virus so smart now they don't go hide. Yeah? So they take medicine now for go damage the brain, or for go damage the testes. So again, the drug they circulate inside the blood, but anytime the virus shed inside the blood, it destroy them. So now really breakthrough scientific trick now they use for able for contain this virus here. So, and I've been in Malawi. I worked in Malawi for about 5 years or so. And we send team go there for go see then people that we still not able for go work, where they don't have us, we sick, we not able for go school. Then gonna not see nobody, because all my way they take the medicine, they're well enough for go work, for go school, for go farm, for go do their normal life.
Okay. Now, when you start, you mentioned about the death rate, where you're saying about 1,800. What are the reason? Is it that not because they know they take the drug, or not because of point finger?
So mostly because of point finger, and it look like some people they consistently take the medicine. Now the thing nowadays. So secondly, one of the things that they contribute back to the high mortality. Now they picking them, because what's happening now with this medicine, every belly man, if you test positive for this virus here, you start the treatment right away. The treatment not only good for you because they remove the virus from your blood, the detector, it's good for the baby as well. It makes sure say the baby not get the infection. And if the baby not get the infection and the mama healthy, where the baby born, now joy for all man. But if the mommy way is pregnant, he not take the test, he not know his status, then he infected, it's very likely say you go infect the baby as well. And when you infect the baby they will find out very, very difficult for thrive. Even though we get medicine for them, but they find it extremely difficult for thrive. So again, that's now one area where if we get control over testing all pregnant women and putting the positive one on treatment, we can completely eliminate pediatric HIV and AIDS. So now one of the good thing in that, but this treatment business, the treatment good for the person. In this case, the pregnant woman, it's also good for the baby. When the baby will come, you don't need to worry about HIV treatment at all. So for me, the important thing that we get 9 months. 9 months for fit for the MPKSO. If you're able to manage this year over 9 months, they became born, you don't get HIV, he grew up, you don't get HIV. 9 months of effort. But if you don't do that, you became caught HIV, you get nearly 50 years of struggle in life.
Right. So waiting at the channel, if somebody will get AIDS, one for take this medicine them. Or
The
one for
medicine
get
free.
access to the medicine.
The medicine
Who side
free
will
now.
get them?
All public facility, all public hospital, the medicine free. And what we want for do self now for make sure say we integrate her into the services. So you not come and say this now AIDS person now free medicine available. The test also free. Now all public facilities in the country.
We get enough.
We get plenty. We get enough. And what's happened? The government of Sierra Leone not only support that, we get major partners like the Global Fund, they provide all the drugs there for we. So again, with the combine between the government, the Global Fund, the U.S. government, other development partners, we all work on this together. And so in terms of test kits, in terms of the drugs, we ensure say we get free access to the drugs. When we get some problems with stockouts at times, sometimes the commodity then they can't sit on our Wataki. It take forever for getting out of Wataki. About a year ago, they complained to the president. The president, we call Wataki people, we call Ministry of Finance, we call all people that were concerned about this. The president say, this is now one of the most important things for do for this country. So he declares say no medical equipment or supplies for this country go sit on our Taki for more than 48 hours. So since that thing now with the drug and the car will declare and quick one.
Now did you ever would declare on?
Yes, because it's not a humanitarian thing. They sell the product, they not get non-commercial value, and besides, any minute where you hold on our Wataki, you deprive people in the country then from the drug. Then. So even the Wataki people and even NRA, everybody agrees say it's important for clear the medical community. So in good time.
Doc, we don't talk about HIV and AIDS. You talk about 77,000 estimated cases of HIV in Salone. This number, is it alarming to una as people with manage the health system?
Well, anytime where somebody get infected with HIV, na concern. But say, Salone get one of the lowest prevalence in the region. The population-based prevalence now about 1.7%. So relatively low. But for every one case we're preventable with the FETAM for preventer. So, but again, not to just look at the prevalence, because the prevalence you use them for compare different countries. And you look at the absolute numbers. For lay you get 77,000 people where they live with this virus. Even though we're able for contain them now, even though we're able for treat them, but we're still not able for cure them. Again, it means say, Boko people and they get for struggle with this every day. So important. But again, we get all of the tools. Then we go reduce the burden for the person because we get a very good drug now for take. And if you take this drug on a regular basis as prescribed, you can go back to regular life.
What are the causes of HIV in Salone?
Well, now as we know, now virus, we get transmitted. Mostly through blood and sex and for picking them, it transmit them from mama to picking. So again, this virus also it cause severe debilitation, and what can happen usually it infect your immune system. The thing where they protect you. You get cold, You get cold. Sometimes they take no medicine. The body they manage to affect them. You get small fever, the body they manage fetter. You get simple illness, the body they manage better. But what's in the virus they do? The virus they go, they attack the system and the body way you they use for fet illness. So now if you get this virus here, if you not manage a simple cold, it will turn other thing for you. Diarrheal disease, if you don't manage that, it will turn other thing for you. In some cases, you carry on till they begin to turn skin cancer for you. So it will get very, very complicated if you don't manage them well.
Why the death rates high, as you mentioned?
We're suspecting are two main, several reasons. First, I think we don't succeed in putting a lot of people on treatment, but we want for be sure say then consistently they take the medicine and for them. Again, if you not take the medicine not go work. And not just until you say I take this week, or I'll say I'll pass next week, or then give you the medicine, you shave them, you begin take part of them, it not go work. You get for take them according to how they prescribe them and for carry on. So we suspect say in some cases then people then can start and stop. So in some cases they can take her inconsistently, and if you do that, and in fact the worst thing that they for do say we take her and then you stop, you can't take her again because you begin to develop resistance to the drug that we will get. So that's not one thing. And then again the sideways sad for me pass all now the baby them. Again if we're able for provide the service to all pregnant women and let them know their status, and if they're positively and they're on treatment, we no need for worry at all about pediatric HIV, because again the beginning will born without the infection, and as I say, the beginning will be born with the infection usually before year 2 they don't die.
Right.
So again that they contribute to the death rate, and again the fact that people with all the stigma and all this problem, people they consistently take their medicine, it'll lead to mortality as well. I mean, about a month ago, one of my cousin in a village, he show up, he cough, and so it happen. Go hospital, go test, and go hospital and go test. He say he get TB, and so if you get TB and you're young, go test for HIV, and test for HIV, the HIV positive. So when you get TB and HIV at the same time, it gets really, really worse if you not take proper treatment for them. Again, this virus here is so smart. Normally people when they get TB, then get treatment for them, or they get TB, then you chest, you work all around, it's on anything. But because your immune system, they keep her in check. If you go damage the immune system now, the TB, they explode. So any young person will get TB. Now for make sure we look for HIV, and if you're positive, good treatment day for TB, actually cure day for TB. So if you're able for cure TB, you don't do well.
Right.
And for the HIV, now for treatment now for the rest of your life.
According to the National HIV Secretariat, now that Simoso, HIV or AIDS, they are among girl picking them, young picking them, boy and girl, but the girl picking them more, they in a high number because of the sexual gender-based violence which can happen to them. What's in the ministry they do in that aspect for make sure say when I put them picking them under control because of some of the issues that were just mentioned?
Well, gender-based violence is much broader in scope. And you say gender-based, sexual and gender-based violence now more about power than it is about sex. So people then they dominate and they use their power and their status and their position for really treat women badly, and then they're completely unacceptable. So I don't want to begin focus and set out the girls them alone, because again we don't want to victimize them as such. But the treatment is very, very good for girls and for women them. The treatment is very, very good for man them. But as I would say, if this is not a sexually transmitted disease, every time the man get infection, he get a sexual encounter with a woman, in a lot of cases you deposit a lot of the virus in that way. And the woman, they receive the virus. And the other way now is much, much more difficult. If woman infected for transmit to the man, it's much more difficult. Where it's a lot easier for let the man transmit to the woman. So again, we want to make gender issue, even though the disparity there, then we get a solution for everybody, and get commercial sex workers where extremely vulnerable, where the infection rate amongst them very, very high. But now we get a new medicine, a new formulation, what they call PrEP, where they get prevention. If you're a high-risk person, if you take this PrEP here, so it prevents infection, it tries to remove the viral load to a non-detectable level, such that you're not able to transmit the virus, even if you're in such high risk.
Okay.
So the tool there for treatment, the tool there for prevention, again, we get everything what we need for manage this, but yet we get people and they die from them. So again, we need to get some major introspection as to what to make that need to happen and try to address as a people.
And another issue, Doc, now the issue of prostate cancer. We see the First Lady and the First Family get a work for sake of prostate cancer in relation to the partnership between the UK Salon and that of UK and Salon Cancer Partnership. Now we look at cancer or prostate cancer in the country.
So again, before we talk about prostate cancer, I think say all man they fear the word cancer. It's not cancer, So say this body also all part of our body na cell that na made of yeah. The cell that where they come together and make the skin, cell and they make the hearts and they make the liver and make the lungs, they make the all thing power body. The fundamental waste in a cell. Well, then cell also, then they divide and get lifespan, and they live, then grow, then die, and live, then grow, then die. Well, so cell and one thing, the cell and can just baranta, then begin grow no more by themselves, and begin grow, then they take all the nutrients, then self no more, and then they grow. Then kind cell and they call cancer cell. So it can be any side of the body. You get any cancer in the skin, it causes skin cancer. Now the lung, it causes lung cancer. Now the liver, it causes liver cancer. Even the testis is called testicular cancer. So all sides. But in this particular case, for man them then gets the bladder where they collect all the water they drink, where they clean the body in system. The bladder they collect them, then it come out as piece on a regular basis. Well, just below the bladder, one small organ there, we then call the prostate. It's but a small organ. It surround the tube where they come out from the bladder, where the piece they come out. Well, that tube something in the tube they grow just normally. When we begin grow, at times they can oversize, they begin twist the tube beside the piece they pass. It will cause problems, especially when they get older. But in some cases now, some cell them pan this prostate gland here, so then they begin grow past mark. They're not able to stop them, and they grow no more, and they big. So then grow, then they're able to obstruct the side where the piece they pass, and it cause problem then for man them. So for man them, especially black man them, now one of the biggest killer them na the world, not to salon no more, inside outside black man, and we seem to get a greater propensity for we get cancer of the prostate gland. So the First Lady, such an incredible person, he say for this year, for celebrating birthday, we'll give the First Lady cake. You get plenty cake. Give her flour, you get plenty flour. Give her chocolate, you get plenty chocolate. So he say this year, what's in it do now? They give a gift to the nation. The gift to the nation now awareness of this prostate cancer for all men. So they walk along the beach from one end of the beach to the other and return. And the husband, His Excellency the President, join them for that. Again, now important symbolism, because now this country, last year alone, about 2,200 men died from this prostate cancer. And what's happening with this prostate cancer, one of the biggest things about that, you can able to prevent her if you detect her early. And if you detect her early, I think say for all black men in particular, if you don't pass the age 40, important for you take the test. Because what's going to happen, as this prostate cancer gland inside they grow, it pulls some water, what they call PSA, prostate prostate specific antigen, PSA. You don't need to know the name, just say PSA. So this now circulates inside the blood. If you check the PSA, if the PSA plenty, that means the prostate they grow. And if the prostate they grow, you worry say if not cancer or not, then you examine them by going through the bottom and check them. If it's rough, then you know say this is probably prostate cancer. Then go take small biopsy, then go test them. But the important thing, not for wait for find a diagnosis for we all black men and they at high risk for this prostate cancer. If you're 40 years and older, you get an even higher risk if your papa, your uncle, or your brother, or your grandpa, or anybody in your family don't get prostate cancer before. The risk of you getting cancer, prostate cancer, is very, very high. So the solution now, not for wait. Every year, go take the test. And for the one already at high risk, for taking even more frequently. You know, if you ever do that, you can detect the prostate cancer early. And if you detect them early, we then go treat them, we go progress, we then go manage them, we go die from that. So enough, necessary death for let people and die of this, we able to get solution. And the solution now, no worry about nothing. Just make sure say the sister them, the pikin them, the mama them, the brother them, the whole family, anybody who don't pass 40 years for them birthday, if you aren't getting gifts, make them take the PSA test as their gift, because that way you will save their life.
All right. Again, this cancer the cure.
So the treatment, again, as I say, no focus on the treatment, no focus on prevention. But for treatment, for treatment, you can get surgical incision, you can get chemical, biomedical treatment, you can get drugs for them, you can get manipulation for shrink them. But the most effective treatment now radiotherapy. So radiotherapy, again, the president, promised he will get a cancer diagnostic and treatment center. Again, for this cancer diagnosis and treatment center, we don't estimate say it will cost about $27 million for Bilam. So the government don't raise about $7 million. And the last time when the president go Vienna, he actually meet with the head person we're responsible for this for IAEA. Instead, Donkana Salonia a few weeks ago, and we committed now for move forward with building this cancer diagnosis and treatment center for bring the radiotherapy capability in a salon. The problem we don't get now two kind machine in there. One they will then call cobalt 60 with a radioisotope then they use inside it. And the management of radioisotope is extremely complex. They get IAEA for certify. And the other one they call a linear accelerator with a more modern equipment. One get all two the one in there, and the power where the president don't go plead for in IAEA in Vienna, the panel come and say they're ready now for move this forward.
All right. As we wrap up on this particular topic, within are the signs and symptoms, and within are some of the causes of prostate cancer?
So again, very likely say genetic thing, because again, a black man and more this year they cause black man, they cause they put woman them and man them, and black man and they are very, very high risk. So again, a genetic factor they cause this. Like I say, if your papa or your uncle or your brother or your grandpa don't get them, the chances say you will get extremely high. Okay. Again, low no focus on the signs and symptoms, because by the time you get the signs and symptoms, it don't late. Because with this theodore with the gland on big now, it don't swell, it block the piece hole, then the piece not able for commodity better. Sometimes you get blood inside it, you get frequency of urination, you get blockage on urination, you get all kind of complications that come in. But again, no worry about that. Let me go ahead of that. At age 40, take the PSA test and begin taking every year. If you're at high risk your doctor go ask you for Lori do it much more frequently. Certainly, if you're not at high risk, then go solo do it once every other year, once every 5 years. But again, now trend you they look how if they rise, if the PSA they rise, they get to a point where you say, Lori do a biopsy or Lori do an intervention. But Lord, no wait for symptoms.
Okay.
Anybody, any black man within age 40, let me take the test and we'll begin to take care every year.
Okay. Away from the prostate cancer or cancer generally, the National Public Health Agency pull a press release say then they do a surveillance and then they investigate a suspected case of hemorrhagic fever after one incident in Akono. As Minister of Health, what are the latest on that?
So we get one of the most formidable public health agency where the president inaugurate now, so the National Public Health Agency. We have 3 major goals in it. Number 1, now for prevent outbreak. Number 2, now for prepare for outbreak. Number 3, now for respond to outbreaks. So all through this nation here now, we did look out for any rumor, any messages, any suspect, anything. Because of the Ebola experience, we know the wait there 1, 2, 3 days pass, wait something happen when a rumor will not react to. So with that background, we over the weekend we get message say somebody sick and somebody die in Akono. With now suspected hemorrhagic fever. We don't know what's not the basis of that. But immediately within 24 hours, and get a rapid response team where Professor Sa deploy for going to the Kono area. We go, we investigate, we find out what's happening. One young doctor we've been deployed in Kono. We just been to do a phenomenal amount of work whilst he did it. He not really feel well. He come home, he come back Freetown. Unfortunately, he passed away in Freetown. So I don't know why this rumor come out saying a hemorrhagic fever he die of. But what he will do immediately, we will go investigate. We investigate, we set up some team then. Unfortunately, by the time then they go to the body now, they may not embalm the body already now Freetown, yeah. But at the same time, we then continue the active surveillance. They be say all the people that we work with waiting at their health situation. We monitor them very closely. All the people that we contact around, we monitor them very closely. Not to say we see hemorrhagic fever or suspect hemorrhagic fever or whatever. If we get any rumor of anything like that, we get active surveillance for ensure say first not true, secondly, and for make sure say you don't get secondary transmission, you don't get other case them. If you get other case them, for identify them early and get active intervention on them. So again, I think so our deepest of deep condolences to the young doctor who passed away. Again, we don't know what he died of at this point. But again, out of just an abundance of caution, we get an active surveillance system where they watch the situation.
Now, according to the Public Health Agency, they don't send the sample now the 34 military hospital for investigation. That result don't come out?
Yes, the result don't come out when the
What's
result indeterminate. Indeterminate because there be no embalm the body already. So when you don't embalm the body, you don't destroy all of the thing we did it. So you don't know it's not if not it gets hemorrhagic fever or not. Yeah, that now indeterminate. So again, we don't know if you get or not. But what should they do now? Now active surveillance. All the people that have been around. If you do operation, then but all the people that will do the operation, nobody not sick yet. Yeah. Okay. All the people over there around and nobody knows sick it. But again, out of an abundance of caution, we they monitor them all, we they watch them all, we they ask them all for take them body temperature, for make sure so they don't move around too much, then they're around, then they take care of themselves. We they carry down there for 21 days. Right. Because again, you get a broad range of virus that we look for, we can cause hemorrhage. We get Lassa fever, we endemic now, so. You get Marburg, you get Ebola, you get Rift Valley, you get all other virus that way you look out for. But in this case, we're not sure of anything, but out of an abundance of caution, we monitor the situation. But I'll tell you now one thing. I think this salon, we get to be very, very proud of the institution we don't create. That's how they talk so. Then get an elite crack force of about 20 Sierra Leoneans with the Rwanda right now. We don't need Rwanda for nearly 1 month for help them for manage the Marburg outbreak with take place there. So
right.
we get a good team.
We understand, say, the hemorrhagic fever and a component under Ebola and COVID.
So like I say, the hemorrhagic fever now virus then where they cause bleeding. So like Lassa fever they cause the Ebola they cause the Marburg they cause the Rift Valley they cause the Congo Crimean virus they cause the but what's in the way they cause that kind bleeding. The hemorrhagic means and they bleed. Yeah. So what's in the happen they get access, we get all of the tests them way before determine which of the virus then they. And we get an active group where you can do on a 34, you can do on a McKinney, you can do on a Kenema, you can do on the National Reference Lab now, so they're all day alert. And we get in which this country after we Ebola experience, we know they take anything for chance. We know they left anything to chance. Rumor, innuendo, suspect will cause an alert. An alert, they get an immediate response. So now that now they take place now. So I don't want to let anybody worry, let anybody know concern about if it becomes in a hemorrhagic fever, we're in control. We're ahead of them.
All right. As we get Tim again inside the program. What thing would be your message to Sierra Leoneans, because we don't talk about a lot of issues that we get for do with the health sector this morning.
So 3 messages. One for HIV and AIDS situation. I think so they do extremely well, but I think so we need to come out and support people then where they're on treatment, for make sure so they remain on treatment and get viral suppression. And this now we all collective effort for use the rights of them people are so the obligation to well follow maintain them, especially the Peloma Nelo, make sure so we know their status so that we will protect them and protect the baby that where they born. The second message with prostate cancer na black man and sick and a genetic thing where they drive them, you get other factors that were mostly in genetics. So any black man within age 40 for make sure so they can get a prostate test at least once a year for prevention.
Now free or it go cost?
I think it will cost, but will be prohibitively cost. I mean, the test against your life. I think most organizations provide that. My third message now on we safety around health security. And for assure people and say we get a very, very effective national public health agency with Professor Sade lead. And we very, very effective at getting ahead of every problem. We prevent outbreaks, we prepare for outbreaks, and we will effectively respond to outbreaks. As we talk, so the Liberian government, they sent a delegation, so where they arrive on Wednesday or Thursday, for just see how the whole healthcare system will work. As we talk, a delegation just come up Burkina Faso. We can see what we do. So again, with the tribe, we'll not reach the AIDS, but as the health sector, we get the nation at heart, and we will make sure we will prevent, protect, and respond to any outbreaks.
Thank you very much, Minister for Health, Dr. Austin Demby, for joining me inside today's edition of the program Good Morning Salon.